Okay, Steve.
Good evening, everyone, and welcome to tonight's Facebook Q&A session. My name's Steve Maddern. I'm the Director of Public Health at Swindon Borough Council. Very delighted to be joined this evening by some additional colleagues. So pleased to welcome Annette Perrington, who's our Director for Inclusion and Achievement at Swindon Borough Council, and also School Lead Graham Davis from Great Western Academy and Kate Hynam from Crowdys. So welcome this evening, everyone. Really delighted to have a special guest with us to talk about the return to schools and very hopefully to provide you with some information and reassurance as we see our children going back as of next week. We've had a lot of questions asked of us in advance, and hopefully we will be able to address all those questions and concerns that you might have, as well as providing you with some additional supporting information that may help you as you prepare for your children to go back to school. So before we get into the detail of the questions, and I'll hand over to Annette to lead on those questions with our colleagues, I just thought I would provide you with a bit of an update in regard to the COVID status of Swindon at this moment in time. If you've been following the media, you'll recognise that across the last week, we've had a little bit of a bump in the road, and we have seen our case rates increase ever so slightly. The case rate is coming back down now, but it's really important to remember that Swindon still is an outlier in the southwest in regards to regional and national averages, but that is no different to how we've been throughout the entire pandemic. The positive thing to say is, from a children's perspective, the case numbers in children have remained consistently low throughout Swindon, and despite our increased case rate across Swindon at the moment, the numbers in children still remain in line with the regional averages. So there's no real difference or concern to be had there. The main cases we're seeing at the moment in Swindon is very much focused in those younger adults. So if you're between 20 and 50, but particularly between 20 and 29, it's really important to be extra vigilant around protecting yourself and other people at this time. To put that into context, the case rate for Swindon at this moment in time is 100 and no, it's exactly 100 today, 100 per 100,000. What that means is that we're seeing around 220 cases per week, and not forgetting that Swindon has a population of around 220,000. So although the case rate looks high, we're still seeing much smaller numbers than we did back in January. So we need to continue with reinforcing that messaging, but we appreciate that this may cause some anxiety for parents, carers and guardians as we're preparing our children to go back to school as to whether it should be safe to be returning to school at this time. And we know that it's incredibly important for our children to be going back, and that the schools have done all the preparations they can, as well as the government in supporting schools, to be able to welcome children back next week. So without further ado, I think that's enough briefing from me for a change. I'm sure I'll end up answering a couple of questions as the evening goes on, but now let me pass over to Annette.
Hello everybody, and thank you very much for joining us today on this Facebook Live, and I would especially like to thank both Graham and Kate for their offer to come and talk to us today about how they have been supporting the opening of their schools. And as always, it's a massive thank you to Steve, because very reassuring, Steve, to hear that message. So we have been sent in some questions. We're going to read out some of those questions and hopefully offer you the level of assurance that we feel confident about as children return to school beginning of next week. I know it's a time that everybody has been looking forward to, but as Steve said, there are still significant measures in place, and we do need to remain vigilant so that we can follow that roadmap, and then hopefully as we move towards the end of the summer, some of the restrictions that we've all seen will be lifted. So without any further ado, we had a question to ask: why is it important for children to return to face-to-face education? I think that's universally accepted. We know Chief Medical Officer Chris Whitty have been talking about the balance between children missing out on their education in a social format, and also the impact on their learning and emotional well-being and mental health. So we know that it's important for children to come back to school. We know that there have been many children and families who've continued to attend school throughout the lockdown, where they have been parents, where they've been children of critical workers, or where those children have best received their education in school. Now it's time for everybody to go back, to get that balance back into lives. So I think it's important that we assure you that your children returning to school is in their best interests, and I'm sure for many of you and your children, they're very much looking forward to doing so. We had a question from Ruben to say, will there be a rise in the cases as a result of pupils going back to school? And Steve, I was just wondering if you could answer that for us, please.
So I think that's a really good question. We can never say never. Obviously, we're doing an incredible amount of work across Swindon at the moment to make sure that we don't see those rises. And I think the work that schools have done to keep children safe will help to contribute to the continual downward trend of our case rates at this moment in time. And the introduction of testing in our secondary schools will also help with that, because it will help us to spot people that may have symptoms of COVID. We know that 1 in 3 may have COVID but don't know it, and to then pull them out of the community to prevent that onward spread. We will see additional cases through the introduction of lateral flow, I'm sure, and that will contribute to our case rate. But that's why it's really important, not just what kids are doing in school and what teachers and support staff are doing, but very much what's happening outside as well. So Annette's mentioned the roadmap out of lockdown, but we will only get to those dates if we continue to follow the rules both inside and outside of school.
Steve, just to say, I think there's a slight delay, so and a little bit of feedback. So if there's a slight delay, it's because we're having to go on and off of mute. But thank you, Steve, that's really helpful. There was a question from Joanne saying, do I need to send my child back next week? And the answer to that is yes, it is now going to be mandatory from the 8th of March for all children to return to school. Very clear DfE guidelines that is expected, that parents will return their children to school, and the same aspects of education attendance will take effect from the 8th of March. It's fair to say with the testing which is in place in secondary schools and the numbers of young people who do need to be tested, there is some flexibility as to whether your child will be going back on the 8th or whether they will be going back in the week of the 8th of March. But I think it's also fair to say that it's really important that if your child is anxious, or if you are anxious, that you speak to your school. They will be able to support you with some strategies around supporting your child to return to school. And there's also the opportunity for you to contact an education welfare officer. We've put some information out, and there will be information on the website tonight. If you feel that your child is really displaying a high level of anxiety, or you are, and we will be able to support you on individual cases. So I think it's important for that for you to know that there is still support there. And I think that's really important. But yes, you are expected now to support your child returning to school. We had a question around what measures are being put in place to be able to keep children safe when they go back to school. And you'll know that some of the additional testing which is being put in place, and also the offer for home testing for parents of children with lateral flow testing, has also just been announced in the last couple of days. There's obviously the reminders of the hands, face and space guidance, and also all of the opportunities and the measures that were put in place before and throughout all of the lockdowns. are still in place around extra cleaning within schools. Many schools are maintaining bubbles, and we'll hear from our two head teachers in a minute about what they've done in their schools. But of course there are some additional expectations around the wearing of masks for year 7s and upwards. And I think that's really important, and we know that there have been hundreds of masks delivered into schools to ensure that pupils have those masks available. So please don't worry, or say to your child, don't worry if they lose their mask or something on the way to school, that there are plenty of masks which are available to be given. So I'm going to ask Graham, if I can please, from Great Western Academy, Graham Davis, Principal, just to talk us through, Graham, some of the things that you've done at Great Western to help your children return to school.
Thanks, Annette, and thank you, Steve. It's a real privilege to be able to talk to you tonight and to represent the head teachers of Swindon about saying how passionate we are about the students coming back next week. Remote learning has been great in lots of ways. We've learned a lot. We've got an awful lot better at it, I think, over the last 8 weeks or so. But nothing replaces that interaction you have in the classroom with students, the collaborative learning that can go on, the skills that you develop through that. And so whilst we can cover content remotely, we really, really want the students back in. And it is the right time to do this now that the government have decided it's safe, with extra measures in place as well. In terms of what secondary schools are doing, well, largely we're going back to where we were before Christmas, but with a few additions. So all the measures that Annette's just talked about in terms of hands, face, space, in terms of bubbling, in terms of having our face coverings in school and things like staggered lunches, different entrances, all those kinds of things will still be in place. And that was to keep students safe. What we've now got additionally to that is the wearing of masks in classrooms as well, again, just to keep people safe, being reviewed at Easter as to whether that needs to continue. But that's where we're starting, and it's not hundreds of masks that have arrived in school, it's thousands. We've got loads of them. So we will definitely be able to support students where we need to with that. And it is important for us, obviously, to make sure that they're in as safe an environment as we can, with ventilation and so on too. And the other thing that's changing is testing. So we are testing, as all secondaries are, students we're testing 3 times before they return, sorry, 1 time before they return and then twice once they're back with us. And that helps, as Steve said, to just ensure that there is even less risk that the infection is brought into school. And so it's really important that parents, wherever they can and feel able to, give us consent to do that testing, because every test that's done just reduces that risk slightly. And that's a big change, a big improvement on where we were before Christmas, and it will make a difference. I would say that organising that's quite a big operation. So we've got a lot to do, and many big schools particularly have an awful lot of logistics to get through there, which is why not every student in a secondary school is going to be back on Monday. They are at GWA, but that's because we're a little bit smaller and we can make that work. But in most secondaries, there'll be a staggered return next week for that reason. It's to get that testing done and get it done safely. Once we've completed those 3 tests on site, then students will get a home testing kit that will be provided by the schools. The schools will give you more details about how to use those. But again, it's important that parents then use those with their students at home to, again, minimise that risk of the virus coming into school. It makes a big, big difference. We want to point out that testing is optional. You don't have to undergo a test, and if your child is not tested, then they still come back next week. That's important to say. But as I hope I've made clear, it really is supportive of the whole process if we can get as many students tested as we can. But everybody's back, and that's what we want to see. I wanted to mention that secondaries are also very, very busy with year 11 and year 13 grading and making sure that we support students in those areas too, which is hugely important for those 2 year groups. And we feel very, very strongly about making sure that they are supported at this particular time. But it's just one example of lots and lots of support that's on offer. Annette's already talked about a few other things as well. But please, if you're at all uncertain about students coming back or your own particular son or daughter and their needs, talk to the school that they go to. We are here to help. We're here to help make sure they come back as safely as we can and to support them with that. And that's what we feel passionately about. And ultimately, we just want to get back to students being in school, learning in school, making the best progress they can, and moving forward from here. So I hope that's been useful. We're very happy to help with questions and things if there are any. So thank you very much.
Thank you, Graham. It's really, really helpful and very reassuring. And thank you for talking on behalf of all of the secondary schools in Swindon. Kate, I was wondering if I could just come to you as you head teacher of a special school, but also representing other special schools within Swindon as well. Obviously, you have pupils who have special educational needs, disabilities, who have education, health and care plans, and some children with additional needs. So if you could just explain some of the systems of controls that you have in place, please, that would be really helpful, and how you're supporting a return to school.
Sure. Thanks, Annette and Steve, for inviting me. OK, so in special schools, first and foremost, and we're really, really lucky and very pleased that Swindon has organised this for us, over 90% of staff in special schools have had their first COVID vaccination, which has given us really big confidence in what we're doing, and thank you very much, Swindon, for supporting us in that. Most of the children come in on transport, so it begins with transport. They have risk assessments, obviously, for individual buses, and they have to wear face masks when they come in. The buses are ventilated. The children are spread out as much as they can be, and as much as they can, they're kept within their bubbles. Once they come into school, they all have to wash their hands as they come in, so that's refreshed every day that they come in. We remind them about washing hands and hygiene. All of the things that were in place from September are still in place. My own school, we've had about 80% attendance so far this term, so we've already got most of the children in. That is the case for an awful lot of special schools across Swindon. We have cleaning throughout the day. We deep clean rooms. I know that other special schools do the same. We have a lot fewer children in class than in a mainstream school, so most of our classes we have all of our children in. We can spread them out. I won't say that we will socially distance, but we really promote hygiene. All adults will wear face masks. We have a lot of cleaning in the rooms throughout the day as well. We carry on with our bubbles, and the bubbles that we had way back in March, we still have the same bubbles, so they are continuing as well. So I would say most children throughout a week probably only have contact with about 15 other people in my particular school, but I know that's also the case in a lot of other special schools. The bubbles are very small. About 15% of our children are being tested twice a week. As Graham said, it has to go on the parental consent. So I would encourage parents to consent to their child being tested. It can be difficult for some children, especially those with special needs, which is why we've only got 15%. But saying that, the staff are still being tested, even though they've had their vaccination, so they're tested twice a week. There are home tests for staff as well, and they're done on a Sunday night to prevent any infected person coming in on a Monday morning. The risk assessments are very thorough, and they've been adapted every month and every time new guidance comes out, and that again will continue. And finally, I would say with the wearing of face masks in class, that is more difficult for us in a special school. We have the majority of youngsters, they can't wear a mask for 6 hours a day. But what I will say is that when we have opportunities for them to wear masks, they do. We teach them about how to look after the masks properly, how to put them on and take them off properly. Certainly when they're mingling outside of the classroom, we encourage them to wear the masks as well. And in the most cases, that has been managed, and I would say certainly in sixth form, the majority of young people wear masks. And And as Graham said, I really would say, if you are concerned at all about sending your child back into school, contact the school, because the school really want to see your children back in. Please send them back in. And if you just talk to your tutors or your head of years or whoever it is who you would normally talk to about these things, we will work with you to try and get your child back into school with minimum anxiety. Thank you.
Thank you very much, Kate. And I think it's really helpful just to see the difference between some of the mainstream numbers and obviously the special schools, especially for those children who may not understand all of the rules around social distancing, and for some who are not able to undertake any form of social distancing at all, and many of whom who have some complex health needs as well. So thank you. I think we had a couple of other questions around testing, and I think we had one from Rose about why are the children being tested and why is it mandatory, and I think probably Steve and Graham and Kate, we've already covered that. It's not compulsory, but it's strongly encouraged, and it's really to pick up those asymptomatic people who don't know that they've got symptoms from transmitting the virus. So the testing is really very important. There was a question though. Steve, I was just wondering if I could ask this one to you, please. What happens if your child's already had COVID? Could you give us an example of whether they would be needing to receive a test, and what happens if a child's already had the virus, please?
Certainly. So if a child tests positive for COVID, then obviously the first thing that's really important is that we ensure that they're self-isolating along with any close contact. So usually that would be the household in which they live, because we know that things like social distancing and all those things don't happen within the household. And the school will also work with us as a public health team as well to determine whether there are any school related contacts. So generally in a primary school, because the bubbles are smaller, we would normally see bubbles going home. In a secondary school, although there is bubbling in place, we will work very closely with those schools very much to see if there's a way that we can very much just focus in on those direct contacts. So if we can prevent from sending the whole bubble home, if the risk assessment is appropriate, then we will try and do that as well. But that is very much case by case. So school by school, you may see some differences if you've got friends or family in other schools. For those children that have tested positive, we would then be discouraging them from testing for 90 days. And the reason that we do this is because when you no longer are infected with COVID, you can still have COVID in your system, which remains to be detectable for sometimes up to 6 weeks and beyond when you first tested positive. It doesn't mean you're infective. It doesn't mean you can't go about your daily lives once you've finished your isolation period, but we discourage people testing in line with the current guidelines for 90 days to make sure that we're not getting those false positives, which may cause a little bit of chaos for schools going forward.
Thank you, Steve. That's really clear. We had another question around testing for early years staff, and if it could you give us just some information on what's happening with the early years staff, please?
Certainly. So we know that it has been an evolving process in regards to COVID, and that things have come along probably not all in the same time as people would want or expect. Early years staff originally weren't included in the national offer in the same way that teachers were in access to home testing, and that has now changed. As part of the community symptom-free offer that the local authority runs, we did reach out to early years staff and carers, to name a few, to access those testing sites, but now they fall in line with all of the preschool staff, childminders and nursery staff, as well as foster carers, personal assistants and direct payment recipients. So they now have access to home testing is the short of that answer.
Thank you. I was struggling to come off mute there. Thank you, Steve. Kate, we had a question around will children who refuse to have the test, even if their parents have given consent, if they have sensory needs. What will happen with those young people?
We would still welcome them into school. It will be very dependent upon the individual's needs. If a young person has sensory imbalances, it can feel quite painful to have a test done. Some of the tests, well, the lateral flow tests, they do feel quite invasive because you do have to stick things down your throat and up your nose. And quite often with children with SEN, we might do it the first time and then we might not be able to get the test done a second time. So whilst we do encourage it, we wouldn't put extra stress on the young person to have that test done. Okay.
But just to reiterate that where testing is not consented or where it's not in the best interest of the young person, if it worries them, the children can still return to school, and that's both the case in special schools and all mainstream primary and secondaries as well. Thank you. I think that's really assuring. We had a question from Tom, and Tom says his child's really excited about going back to school next week, but he's quite scared too. And what can you do to help him understand that school is best for him? So I've thought that Tom's little boy is probably in a primary age group. There's lots and lots of resources which are available on the local offer. There are some books, there are some videos explaining to young children what happens when they go back to school and why it's really important for them. But again, there will be some specific information and guidance on your school websites if you want to have a look at those. And if you think there are any specific additional requirements that you need in order to be able to reassure your child, have that conversation with your child's class teacher. Sometimes we've found that a phone call with a child, sometimes a quick Teams meeting, as people have been keeping in touch, is actually what's needed just to reassure that child that actually they're going back to school, and it's going to be very similar to what it was before, but it just having that conversation with their teacher is really helpful. I'm not suggesting that every teacher is going to be able to do those phone calls, but if you feel that your child is anxious, I'm sure you can have that conversation with your school. What support is, I had a question from Jamie about what support has been available to help pupils and students catch up on their missed lesson time. And we had a quick conversation about this before actually, and Graham was saying, actually we like to talk really more around education recovery. And we know that there are national teaching and tutoring programmes in place. The government has supported schools being able to claim funding for all pupils, and schools are beginning to look now at which young people are going to benefit and how that's happening. And I was just going to invite Graham, please, if you could, just to talk about the arrangements that you've made at Great Western, please.
Yeah, thank you very much, Annette. So there is, as Annette said, money coming into schools, and we need to decide carefully how best to allocate that. And of course, part of this is around making sure we're allocating it in the right way to the right students who need the extra support, whether that's emotional support or academic support. And we've already begun to put some of that support in for some of our students, and we'll continue to evaluate how best to do that as we go forward. But this is a long-term programme. I think that's important to say. It's not something we can't, sort of immediately fill gaps that have been missed. More important for us is that next week students get back into good habits, that we can assess where they're up to properly. I mean, we know quite a lot from where they've been submitting work in lockdown already, but we can find out more, we can support them, talk with families about the best way forward. And there's been discussion in the press around things like summer schools and things like that. I think, to be looked at, to be decided what is in everybody's best interests and also what's manageable. But ultimately, we need to take time to evaluate and to work out how we're going to use that money in the best interest of the students who really need it. And that's where we're at the moment.
Thank you. And is it right, Graham and Kate, that if parents have got any concerns around any learning that their children may have missed, that they come to you, talk to you in the first instance, and you can have those discussions about what may be available or what may be best on offer?
Yeah, absolutely. I'd back that 100%, Annette. So if a parent is aware that there's a particular area that a student's really struggled on, then yes, please contact the school. There may be a reasonably quick way of addressing that, or a much longer term way, but we would absolutely be working with our parents to ensure that students feel confident about as much as they possibly can.
That's really helpful, thank you. And just to reiterate to everybody, whilst we've got Kate and Graham here from a special school and a secondary school, all of our early years settings, nursery schools and also our primary schools are also ready and welcoming young people back. Many have been open throughout lockdown, especially within the early years sector. And I know that all our primary school head teachers have undertaken all of the same risk assessments. They are very live. They change every time some guidance comes out, and we know that there's a significant amount of information on all schools' websites. So I would again just encourage parents to look at their individual school early years settings, and colleges, of course, to look for information in the first instance. OK, I'm just going to go into some more in-depth questions. We've had some other questions around, does my child have to wear a face covering in class? And I think, Kate, you spoke about the fact that for some of your pupils, it's not going to be able to do that. And Graham, I think you've talked about the expectation that year 7 and above would do. Again, can you just give us an indication of where you have some young people who may not want to wear the face covering or who may not be able to for specific reasons? What will happen for those young people?
Yeah, so we obviously students have been wearing face coverings in school before Christmas anyway, so we have arrangements in place with some young people and their families that have specific reasons why a face covering can't be worn. That's fine, and it's arranged on an individual basis. I think you know, they are going to be wearing face coverings for longer, although it's never longer than, in our case, sort of an hour and 40 minutes at any particular time. Then they're outside, able to take their face masks off. So we have to see a little bit how this goes, but it is important. Obviously, it's the new guidance that we follow with this. It is for safety reasons, but we will obviously talk to students and parents where they have concerns that for some reason it's just not possible or physically acceptable for that to be the case. But for most students, I'm sure it will be no big issue, and we will work as best we can with those who it's a problem for.
That's great, and let's hope the weather is kind to us when everybody is outside at the moment. Kate, is there anything else you wanted to add around face coverings? You're just on mute, Kate. That's going to be the saying, isn't it, Phil?
Isn't it? It is, isn't it?
You're just on mute.
Yeah, whilst we're encouraging the wearing of face masks, and we certainly have a plentiful supply in school, so it doesn't matter if parents forget to provide them. And actually, I'd rather use the disposable ones, if I'm honest, rather than the material ones, because sometimes they don't get washed. So really, our emphasis for our young people is to be respectful of others. So if you can wear the mask, you wear the mask. If you can't wear the mask, then we accept that there will be a valid reason for not doing so with our children and young people that we have in our setting.
Thank you, Kate. And I think just talking of washing, that takes us very neatly into a question that we had from Lisa, who said, do I need to wash my child's school uniform more than often? More than usual? My understanding is no, that you don't need to wash your child's school uniform more than usual. If you want to, and it makes you and your child feel happier, then of course you wash school uniform as frequently as you want to, but there is no need for you to wash the uniform any more than you would normally do. And I think that probably depends on the age of your child and all sorts of things, so that's really just up to you, but it's a good question, and I know that's one that many parents will be thinking, do I have to do anything different and extra than we are normally? We had a question from Madeline, and Steve, I'm going to ask you to answer this one, please. It's in regard to people who are clinically extremely vulnerable and who have received a letter asking them to continue to shield until March the 31st. And Madeline has said that she has received her letter and she has 3 children who are due to go back. Do they have to go to school, and am I at risk? And I was just wondering if you could just explain to us about the clinically extremely vulnerable parents, please.
Yeah. Certainly, thank you, Annette. And that's a very pertinent question, and we do get asked that question quite a lot. Before I get into that, just going back to the school uniforms, I think I just want to highlight the key thing that that should be washed are hands. So make sure that you wash your hands really frequently, much more frequently than you'd probably be washing your uniform. And also, if you are wearing masks that aren't disposable, it's really important that they are regularly washed as well. Going back to the question around shielding, as we know, we've had a certain number of people shielding across Swindon during the pandemic, and more recently we've had an additional 4,000 people added to that shielding list. Now, the basic guidance of shielding is that you don't leave your home unless you're going out for exercise, but other than that you shouldn't be going anywhere else. The way that shielding has changed across the pandemic is that those people in your household, unless invited to shield themselves, also do not need to shield, and that also goes for your children. So unless your children are identified as clinically extremely vulnerable, then they should be going to school. Children who are clinically extremely vulnerable should not be returning to school at this time, and your schools will provide you with information and guidance on how to manage that situation up until the 31st of March. One of the questions that we get asked at the moment is very much around how do we get our children to school if I'm shielding? And the advice here is very much, if you have other people that can take your children to school, be that another family member within the household or someone outside of the household that isn't shielding, then by all means encourage them or ask them to support you in being able to do that. The advice and guidance around shielding is just that, it is advice and guidance. So you need to make a decision yourselves if you're clinically extremely vulnerable on whether you feel safe in being able to take your children to school. There are a wide range of medical conditions that would define you as extremely vulnerable, and if you've newly been added to the list and you don't understand why, then please have a discussion with your GP around this, or your GP practice, should I say, so you can understand your level of risk. If you do want to take your children to school and you are clinically extremely vulnerable, then just be very mindful that you have to be extra vigilant in that hands, face, space messaging. Do not mix or interact with people outside of your households. The other important thing is although the schools can keep your children safe whilst they're in school, it's really important that you have good practices at home as well. So as soon as your kids come through the door, make sure that they are washing their hands and that you're keeping your house as ventilated as you can to keep your risk down and low. We can't remove the risk completely, but we can help to lower it. And by following those simple steps, that's really what can help you.
Steve, that's really good. A lot of common sense advice, but obviously some specifics as well. We've had a question here from Reese. Reese says, I'm a teacher, and why haven't I been classed as a priority group for vaccination? So Steve, I was wondering if you could answer that for us, please.
Yeah, that's not a problem, Annette. So we know that the vaccination programme is incredibly ambitious, and the delivery of that programme is determined by the government. From a Swindon perspective, just to give you an update, we started vaccinating in early December, and as of this week, we've vaccinated over 50,000 Swindon residents already. Now, that's almost a quarter of our population, so it just shows you how many people we can vaccinate in a short time, but it just also demonstrates how ambitious and fast moving the programme is. Now, the priority groups have been defined by the Joint Committee for Vaccine and Immunisation, again at a national level, and we have had no local say in who those priority groups are. The priority groups are very much defined by their increase in risk, and we know that exposure to children is a slightly lower risk at this time. That being said, teachers and support staff that work in special schools have had the opportunity to engage with the vaccine programme because of the higher risk of some of the vulnerable children that they are working with. The JVCI has already reinforced their messaging around those priority groups. And I think what we need to remember is that if everybody becomes a priority, then nobody becomes a priority. The locality of Swindon is very much focused on getting all adults aged all adults with their first dose by the end of the summer, and then all adults to have their second dose by the start of autumn. So it's still incredibly ambitious. It's not a long time to wait. Teachers at this moment in time, as we've said, are not a priority, but you will be offered your vaccination in line with those other priority groups. So whether you have a medical condition that allows you access, or as we work down through the age group. So we've already managed, we're already starting on the 60+ age group, so it won't be too long before we move down into those younger age ranges. So I think the message here is please be patient, we will get to you.
Thank you, Steve, and it's really reassuring that a quarter of the population in Swindon have already received their vaccination. Just one other question I was hoping, Graham, just to ask you that has popped up was around those parents where children are having to self-isolate. Again, just to say that the remote learning offer is not yet, it's not a closed down offer because schools are back, and just wanted to have your view on how your school is organising some of the remote learning still being available.
So I think I hope people are clear that should there be positive tests in schools, there will need to be still some self-isolation of students and their families. We hope that's minimised through all the tests and the measures that we're taking, but there undoubtedly will be a few cases like that. And of course, as a school, we will make every effort to ensure that students still get their learning if they are at home. And we're, as we said earlier on, much better at that now than we were when we first had lockdown before. And so it should be that schools can make a fairly sort of straightforward-ish anyway arrangements for students to be accessing their lessons even if they are at home. It'll vary slightly on individual cases as to exactly how that works, how many students are in the classroom and how many are isolating and that kind of thing. But yes, absolutely, we would expect students to be engaging with their learning even if they're self-isolating.
Thank you so much. And just before Steve closes, can I just say a massive thank you to both Graham and Kate and all of our head teachers, early year settings, colleges across Swindon. We have been totally inspired by the amount of ongoing daily work around outbreak management, testing, risk assessments. So it's a thank you to all schools, but also a thank you to all parents who have supported schools and their education settings at this time. And we really, really hope that you feel confident enough to send your children back to school. We want them back to school. We want things to be returning as much as we can to whatever the new normal is, but to get the children back in, everybody, there's a real sense of excitement. So Steve, I'll hand over to you, but thank you very much for the time that you will have taken tonight if you're watching this.
Thank you very much, Annette. So, and again, I echo all the sentiments you've made, and a huge thank you to Graham and Kate to take some time out to spend with us this evening to hopefully quell any anxiety that may be there. And I'm hoping it's more an excited anticipation of going back to school more than anxiety, but appreciate children have been out for a period of time now. I suppose I just want to kind of end and stress that as we go forward with the testing in place, with the steps we have in place, we are still very likely to see those odd cases and outbreaks. They're expected, they're anticipated, the schools are equipped to deal with them, and the support is there from the public health team at the council and also Public Health England to provide the advice and support to protect the children and the staff going forward. So don't feel too disheartened if you do have or see cases, because they are very likely to happen as we move on this journey, which is hopefully into a new world as we get into the summer. The other thing that I just wanted to raise very briefly was you'll also see through the media that there is the offer of testing for family households for primary school and secondary school children. So you don't need, primary school children won't be tested, but as family members, you can have access to that. There are again, so there is an online portal in which you can order tests, which you can have them sent directly to your home and test the family at home. You'll also have the option to be able to collect test kits from our existing test sites, which is Rawton Park and Ryde and also Broad Green. So again, those test kits are available from 1:30 till 7 o'clock on a daily basis. As we look through into March, we hope to be able to expand that, and again, working very closely with the government at the moment around those additional options. So if you are in a workplace that has lateral flow testing in place, by all means use that opportunity to test, and we will be working with businesses across Swindon to try and expand that offer as well. So those are your key points of access going forward. And again, all these interventions that we're doing, the hands, face, the space, the ventilating, all of those things are what we need to make sure that we reach the goals that are set out in that roadmap. And then just to finally say, obviously, we appreciate it's exciting to go back to school and that you would have seen people that you haven't seen for in a while. So please just remember your social distancing at pick-off and drop-up points. Remember hands, face and space, particularly if using public transport to get to school. And if those windows are open on the bus, ventilation is really important. We know that ventilating rooms can reduce risk by almost 70%. So keep those windows open, classrooms, buses, home, and let's get on track with the roadmap. So on that note, I will not talk any further. It's just gone 6 o'clock. Thank you to Graham, Kate and Annette once again. Have a fantastic evening, everyone. And I know the schools look forward to welcoming you all back on Monday. So take care, everyone. Thank you very much. Bye-bye.
Thank you, everybody. Bye.